So I had the fortune in the early 80s to be in practice in Lexington, Kentucky at a large multi-specialty clinic, and I was the only infectious disease physician in the community. And I became really the go-to person taking on the care of AIDS patients. And what happened for me was, as I saw this horrific disease claiming lives, at the same time, these individuals were losing their health insurance. And I saw firsthand, when folks needed their health insurance the most and it wasn't there, what the downstream implications were. And what that did for me was drive me actually to my state medical association, realizing that I thought I could do something and help make things change. And so one thing led to the next. And the next step for me was, at the time, the AMA was doing its work on the uninsured, covering the uninsured, which, as you know, was a very strong piece of the election and ultimately the Affordable Care Act. So it was my medicine that actually got me started, and I'm excited because I'm part of this. I've been working on it for many, many years. Access to care is very important and something that I think all Americans should have. Well, if you think back to those years before the Affordable Care Act, and even the year of the Affordable Care Act and its passage, that listening to physicians and all folks involved in healthcare is and was a very important thing to be doing. I found at the time that I thought we were pushing out information more than we were using information and receiving it and making it part of our decision-making process. So I began as board chair in 2010 talking about bidirectional communication and accountability. It goes both ways. Out of that actually came a task force on SGR, what do we do about it, which is subsequently changed into a Medicare payment and delivery reform task force. So we've taken that effort using physicians and practices, both specialty, primary care, states, using that work to get us where we are right now in repealing the SGR and in Medicare payment and delivery reform. I think it's going to be very important as we look at delivery change and how we in this country want to make practices sustainable, make physician practices thrive and patients be happy, and at the same time improve the quality of care and cut down on the cost, that we're going to be coming to our hospital partners talking about policy changes that may need to take place to enable this to occur. They are going to have to be part of the system as well. This isn't just docs talking about it and trying to get something done. The hospitals are going to have to be part of the system and part of the change. Well, I think we don't know what they're going to be, because right now we're trying to flesh all this together. I think we're going to see, perhaps there are some regulations that need to be changed or modified. Perhaps there are some antitrust things that need to be addressed. These are the types of things I'm referring to. Getting the administrative burdens removed is a huge piece of this. When I have to hire more personnel simply to check the boxes and fill in the numbers, that's a waste of time, energy, and resources. So clearly, we're going to need diminishment of administrative hassle, getting regulations, clearer. I think the other thing the insurers are going to be able to do is working with us as we look at quality measures, what's good, what's not, how can we streamline this. Let's go for measures that matter as we look at quality, and I do believe the insurers can be a part of that as well.